Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. On its second day, more states join in ongoing industrial action by resident doctors in Nigeria. Akwa Ibom government is seeking more vaccines for residents to stem the rising number of infections in the state. In China's Wuhan to test its entire population after witnessing a surge in COVID-19 infections. And 11 people have died from COVID-19 complications on Monday, according to the Nigeria Center for Disease Control (NCDC), bringing the total number of fatalities to 2,160. The agency added that the report for Monday includes deaths in Lagos reported on the 31st of July. According to the Minister of Health, available data indicates that Nigeria is already experiencing the third wave of the COVID-19 pandemic. At a press briefing of the Presidential Steering Committee on COVID-19 on Monday, he solicited state participation in sample collection, reporting and treatment of cases, saying that only 17 states made data or sample submissions in the last cycle. Let's take a look at the report.
Since the last week, Nigeria has continued to experience a surge in daily COVID infections driven by the spread of the Delta variant in the country. While the Nigerian government has officially confirmed that the third wave of the pandemic is already in the country, the NCDC is calling on Nigerians to take responsibility and ensure that all measures to curb the disease are strictly adhered to. The latest figures coming from the NCDC are 444 confirmed cases from 12 states and the FCT in the last 24 hours. Again, Lagos reported the highest share with 275 cases, 63 cases in Rivers. Akwa Ibom had 62, Gombe recorded 22, while 8 cases were registered in Ogun. The FCT had 4, Edo registered 3 cases, Imo had 2, while Kanu, Nasarawa, Sokoto, Jigawa and Ebonyi registered 1 each. According to the agency, there were 0 cases reported from Ekiti, Oyo, Osun, Ondo, Kaduna and Bauchi, as well as deaths reported from Lagos on July the 31st. Nigeria now has a total of 174,759 confirmed cases. 32 persons have been discharged in the last 24 hours, raising the total number of recoveries to 165,037. The agency reported 11 deaths from COVID complications in the last 24 hours, raising the fatality toll to 2,160. With the recent increase in daily cases, active cases in Nigeria have jumped to 7,552, while over 2.5 million samples have been tested so far. 18 people associated with the Tokyo Olympics 2020 Games have tested positive for COVID-19, making a total of 294 confirmed cases as compiled by the Games Committee. Over 6.7 million confirmed cases and more than 171,000 deaths have been recorded across countries in Africa. The total global confirmed cases are getting close to 200 million, while deaths across the world have surpassed 4.2 million.
And it is day 2 of the National Association of Resident Doctors NARD industrial action in Nigeria. And this is following a directive by the national body to members, which started August the 2nd. Report across health facilities in a few states today show full compliance in some states and skeletal services in others. We begin in Bayelsa State, where the resident doctors at the Federal Medical Center in Yenagoa say they are fully complying with the industrial action. The president of the FMC Yenagoa chapter, who confirmed this, says the immediate action has to be taken to safeguard the medical profession in the country, as most doctors are leaving.
We have recommenced our suspended strike after giving 113 days to the government to see if they are really serious this time. And they have proven us wrong again. Of course, we are not surprised. This is the scene that has always played out. Our demands are germane. Doctors that will work for 6 months without pay under the Give Mix platform. This is not right. And you know there is massive brain drain. Doctors are leaving this country every second. And the system is not even bothered. It worries us so much because In a very short time to come, there won't be doctors to work in our hospitals. Our reasons, why are we on strike? Please take away that very annoying circular, taking out house officers from the scheme of service. Yeah, the young ones these days, when you ask them, do you want to be a doctor practicing in Nigeria? They'll say never. And they're writing for any exams. The government should rather encourage, bringing things that will encourage or motivate our doctors and other healthcare workers to stay in the country.
It's a similar scenario in Cross River State, where the leadership of the association says there's total compliance at the Federal Medical Center, Calabar.
Nigerian Association of Resident Doctors gave government some demands, and also we had an ultimatum which expired at our meeting, National Executive Council meeting, and these include the fact that our house officers were not paid salaries. However, house officers have been paid salaries, but we still have a lot of issues. You know, a few people are not paid some months, and some allowances are not being remitted. And we also had asked government to abolish what we call bench fees.
Meanwhile, in Edo State, the governor, Mr. Godwin Obaseki, believes that the ongoing nationwide strike by resident doctors is coming at a very wrong time. He believes that even if the doctors have grievances against the government, the industrial action could have adverse health effects as the country grapples with the latest wave of the coronavirus pandemic.
I am not sleeping. I'm not able to sleep because I'm just worried. And somebody who doesn't worry about it. But from what I'm seeing and perceiving with the Delta variant, I'm concerned. I don't think we should lose any life. We will appreciate it very, very much if you guys can call out all your members from across the state and just look at it as an Edo thing. It's about us. It's about, we don't want to worry about what is happening anywhere else. Let's just focus on us and our people. And as much as possible, make sure that we do everything in our power not to lose any lives. And call your younger doctors, try and appeal to them. That even if you are going to go on strike, we understand things are difficult. You know, promises have not been kept, but not now.
In Plateau State, the management of the Jos University Teaching Hospital had summoned an emergency meeting to map out strategies to cope with the effect of the strike action embarked upon by Association of Resident Doctors. The Chief Medical Director of the Teaching Hospital, Professor Edmond Van Waard, expresses concerns on the negative effect of the action, which he says would adversely affect the patient.
The earlier demand that was issued was a 13-point demand, and all of them concern our members here in Jute. And as I speak to you today, some of them have been addressed, but not completely. We are lucky in Jute with regards to the payment of house officers' salaries, because all our house officers have been paid. But the situation is not the same with some other hospitals, like the Lagos University Teaching Hospital and others. Not all the house officers have been fully paid. Then the issue of medical residency training fund. Of course, it affects all the centers, and Jute inclusive, nobody has been paid.
For more on flattening the coronavirus curve, joining us on the program is Professor Yawali Tomori, a virologist, Chairman Expert Review Committee on COVID-19. He joins me now via Zoom from Ibadan. Thank you for joining us on the program.
It's my pleasure.
Now, the PSC confirmed 32 cases of the Delta variant in Nigeria yesterday, with the highest number in Akwa Ibom State. And it says from returning travelers and also local transmission. Is it surprising that we're seeing this resurgence, especially in the southern state?
Well, I think, first of all, I think it's important that we know that it's not the states you're talking about where the problem is. I think we should have been proactive enough that it's a national problem, not just for Lagos Akwa Ibom was not even on the list before. But now, just looking at the data that we have here, in week 28, Akwa Ibom had only 28 cases. Now the number has shot down to 200 and something. I think our problem is that we're not proactive enough. We don't take the data we have, analyze this quickly, and use it to plan response. And that's what is happening to us. If you go back, I mean, some of the data we have, we should have known weeks ago from week 25, for example, the number of incoming passengers who are testing positive has been increasing. So also the number of outgoing passengers who are going out of the country, also the positive rate has increasing, which means that the thing is spreading. It also means with the incoming passengers, we are bringing in more cases. But then even our studies, to show when this COVID Delta arrived in the country, we're like about 4 or 5 weeks behind identification. And that's the problem. Because by the time we detect what is happening, it will have spread all over the whole place, and we're not in a position to control them. And that's why we advised the government long time ago, test people on arrival. And then you can follow up the few that need to be followed up. Not telling people come back 7 days later and then you discover you don't know what they have been in the 7 days. You don't know whether they're in isolation. So we are creating the problems for ourselves, and we should be ready for the repercussion.
Some of the measures the Presidential Steering Committee talked about also was promising to publish, names of travelers who had violated their travel protocols, also those who have evaded quarantine. Is that not sufficient?
That is medicine after death. They will have transmitted the thing by the time you publish their names in the papers. Those people will have been all over the country and will have spread it. The aim is to prevent them from spreading the disease. It's not putting their name on the listing after they have spread the disease. And that's the point we're raising. Catch them before they become a problem. Putting all those things on. And in any case, if you put my passport on and say I can't travel for 1 year, I don't need passport to travel within the country, do I? And I may not even decide not to. I've not traveled out of this country for the last, since COVID came. It's almost 1.5 years. So you can take your passport. And if I don't need to travel, I don't need to travel. It doesn't stop me from moving around the country. I think that's medicine after death. We should make sure that we catch them before they become a problem to us.
The NCDC has always said that, subnational state governments have a role to play in this. What do you think they're doing? This is to stem the tide of the virus.
Well, I think it's, as you said, it's a national thing, which means it means everybody. In fact, we keep spreading what's the government doing, what's the government doing. The major problem is what we as individuals are doing. The government is not the one spreading the disease. It's me and you who are not wearing our mask, who are not washing our hands, who are still going to all those big parties and attending all those weddings and all those things that are spreading the disease. The government can only give information. If you don't believe your government and you don't trust what the government is saying, then we have more responsibility as individuals in the spread of this disease. And the variance we are getting is only because we're allowing this virus to transmit from person to person. It's like your mobile phone. When you put your mobile phone, that's where it is. It becomes mobile only when you carry it around. We are the one carrying these viruses around and getting variants out of them. If we do our role, the government's role will be quite minimal. But then we are not following even the guidelines that the government is giving. Even some of the government people are not even following the rules they are giving. We see some of, I don't want to mention names, but I remember there was one thing that Punch brought out, where my president had his mask on and then went into the hall, the big hall, and I removed his mask. Those are the kind of things we're saying. You cannot be saying one thing and do another thing.
Finally, let's quickly get your thoughts. We just received the Moderna vaccine. What's your take on it, especially for those who feel that some people say they've gotten the AstraZeneca at the beginning, but they couldn't complete their full dose. Should they be given the Moderna vaccine?
For now, the MPACDA is not mixing vaccine. So those who got the first dose of AstraZeneca will have to wait when we get the next donation. I don't know when that will occur. But for now, the Moderna people, just get your Moderna, your 2 doses, and let's not mix things up. It's going to be a lot of confusion because we're going to have people who have 1 dose of Moderna, 1 dose of AstraZeneca, and then another dose of Moderna. So right now, let's be patient enough until these batches for the, I don't think there are many who have not received the AstraZeneca second dose. But whatever happens, my advice is let's wait until we get that AstraZeneca coming in. Those who have Moderna, let them use Moderna as it is. But let our government go and buy vaccines, not waiting for donation.
We always appreciate your time on the program. Thank you so much, Professor Yawali Tomori, Professor Virologist. Thank you for joining us on the program.
It's my pleasure. Thank you very much.
We have more on the global trends of COVID-19 when we return. Please stay with us. Welcome back. It's mixed reactions to the restrictions in place for travel, especially British holidaymakers who are happy to be out and about, traveling to visit friends and family members whom they haven't seen in a long while. Our correspondent Juliana Lainka has the rest of the story.
Another day, another Conservative government U-turn, this time in favour of British holidaymakers. Last night, a proposal to create an amber watch list of countries at risk of moving to red in the complex and confusing traffic light system was dramatically scrapped. According to sources, no new categories will be added to the system.
With Prime Minister Boris Johnson's approval rating falling 36 points between the months of June and July, the last thing the populist leader would want to do is ruin the last few weeks of summer holidays for British holidaymakers and potentially put them into financial turmoil. It costs £1,800 for a holidaymaker to quarantine in a British hotel. If you add on top of that the mandatory PCR tests, for a family of four, they could be paying an extra £8,000 on what was supposed to be a relaxing British summer holiday.
I don't mind the restrictions here. It's fine. It's just being able to travel. That's what we kind of want to do, and so that's what's really stopping us. And we're oh, we just want that, and then we'll be happy. But I guess that's going to take time because obviously a lot of us are vaccinated, but the rest of the world and all these variants and stuff, that's what's stopping us.
If you get stuck up there, then you have to pay for extra accommodation and stuff. It's just it's not worth the hassle. Until it's more free, I think. Yeah.
No, you take your risks when you book it. If you're choosing to go somewhere and then it changes, you kind of know that it might change. So I kind of feel well, take the risk yourself.
For fully vaccinated travellers living in America and within the EU, new rules that came into effect on Monday morning created these emotional scenes at British airports. Families that haven't seen each other for over 18 months, finally reunited. For British travellers going the other way, though, the acts on domestic rules have not been reciprocated. For now, though, the UK's increasingly complex travel system appears to be simplifying. But with beleaguered airlines battling for survival, Thursday's update on what happens next has become more important than ever. Juliana Olainka, reporting for Channels TV News in London.
Meanwhile, authorities in the Chinese city of Wuhan will begin testing its entire population after a handful of positive coronavirus cases were detected there. Wuhan has recorded 7 locally transmitted cases, the first local infections in more than a year. The city of 11 million people shot into the spotlight after the coronavirus was first detected there in 2019. China is currently seeing one of its biggest outbreaks in months. Here's more on the global update.
China's Wuhan city will test all 12 million residents for the coronavirus. That's after the place where it emerged in late 2019 confirmed its first domestic cases of the highly transmissible Delta variant. Wuhan had reported no local coronavirus cases since May 2020, but on Monday, authorities confirmed 3 new cases of the Delta variant. Over in Japan, a Tokyo hospital director warns that Tokyo is on the edge of facing a medical collapse if more beds to treat COVID-19 patients are not secured immediately. Japan has seen a sharp increase in coronavirus cases. Tokyo, which had a record high of 4,058 new infections on Saturday, had another 3,709 cases over the past 24 hours. Australia's most populous state, New South Wales, has reported nearly 200 new coronavirus cases as the country enters its second month of battling a Delta variant outbreak. Authorities say of the new cases, at least 50 spent time in the community while infectious. Sydney's lockdown has been extended and some 300 army personnel have been going door to door to ensure people who have tested positive are also isolating at their homes. Health workers and volunteers from Mumbai's local authority have conducted a door-to-door COVID-19 vaccination campaign, inoculating vulnerable people who are unable to go to vaccination centres. The measure comes as Maharashtra state eased COVID-19 restrictions in more districts, including in the financial capital of Mumbai, after a steady decline in cases.
All right, let's head back to England, where our London correspondent Juliana Olainka joins us right now. Hi, Juliana.
Hi, Millicent. Can you hear me?
Good evening. It's good to see you. Yes, I can hear you loud and clear. So, since Freedom Day, so-called, what's the update on the virus curve? Is it receding or otherwise?
Well, there's a little bit of mixed data, Millicent. So yesterday, coronavirus positive cases were about 21,000, which is the lowest we've seen for a day for about 6 weeks. But last week, deaths were at a pretty, I think about 3 months high of about 323 deaths. Now, scientists and health officials are saying this is because of the lag. Of course, you can't always get the data to work together. So on the one hand, yes, cases are falling, because I do believe the last time we spoke, there were about 50,000 positive cases a day, but we're still not out of the woods yet. There is a good thing. I believe about 88% of the British adult population have received at least one dose of the vaccine, and about 72% have received 2 doses. So we seem to be on the right path. But of course, as we're seeing across the world, the third wave is still very, very, very serious.
When it comes to travelling to England, I mean, is it less or more complicated? And this is with the traffic light tests, the amber, the green, or the red.
Oh, goodness me, that's a £1 million question. I'm not sure I know the answer to that. But I think, yes, it should be more easier. As said in my report, Monday at 4 a.m., there were new restrictions. Restrictions were removed for passengers from America and the EU. So if you're fully vaccinated and you're from those regions, you can now travel into the UK without having to self-isolate. And that's absolutely massive, especially for the beleaguered travel industry. And of course, sorry. From there, it should be easier. But the complexities with this travel light system is really for British travellers. We're in August. This is the peak time of the summer season. People are desperate to get away, which is why everybody is waiting for Thursday, when the Transport Secretary, Grant Shapps, will be updating the country about what can be done for the summer. SOS is the headline. Save our summer is what the British...
All right, very interesting there. Hopefully we'll get to hear more updates then. Thank you so much, Juliana Olainka, a London correspondent. Thanks again for joining us. And indeed, let's all continue to stay safe and take responsibility. You can visit our website for more updates, also a better understanding of the pandemic. It's channelstv.com, and it is at your fingertips. Thank you for watching the program this evening. I'm Millicent Walker. Stay safe.